think we're going to start off. We had some early questions.
Hey, let me go in the Q&A and see. Okay, we're not seeing the questions, so let's start with the early questions, the questions that were sent in to us earlier. Eric, you want to read them out?
I have to put my glasses on. Okay. Make them bigger. Okay. So actually, the first question, actually, is a very interesting one because I think it's important for people to realize. I have many health issues regarding mycotoxins, viruses, bacteria, uh, and but oh, okay, this is it. Okay. Many interesting questions. He has mycotoxins, viruses, bacterial infections, inhaled allergens, and also is immune compromised, has POTS and some problems with low hormones. And they would greatly appreciate our expertise regarding in what order and generally how you would address these. Um, Both I and my doctor in the UK are completely overwhelmed. Okay, well, good reason to be overwhelmed. You got a bunch of stuff going on there. Um, and I'll let maybe before I start, you want to take
Sure.
a shot at that one?
Yeah. I wonder, let me see what the diagnosis. You've got mycotoxins, viruses, bacteria. Okay. I also wonder what other diagnoses you've got on specifically regarding um, long COVID. Okay, so anybody who's coming into my practice now, I can't help but wonder about that. So I would do testing to see if there's a reservoir, okay, a reservoir of maybe spike protein or virus. And I like to test for these things first before I begin any treatment because then I know what direction am I going to go in. So we can use the Infectolab test. It's called the SARS-CoV-2 spot test. That's going to show us interferon gamma and interleukin 2. If interferon gamma is high, it means we have a reservoir of either spike or virus going on. We can use the T-Labs test to look for spike itself, so then we can narrow it down. Does the reservoir seem to be spike or viral? We can look for microclots through the MedHelp test, and then through Radiance Labs, we can look at or Infecto Labs, the cytokine panel. So that's one thing I never want to miss out these days. Now, if you've got dysautonomia, there's probably issues with your vagus nerve. We know that tick-borne diseases can actually hide out in the nervous system and affect the vagus nerve that way. Well, COVID reservoirs or spike reservoirs can do that as well. Most of our patients have issues with their vagus nerve. That is why there's the POTS, the dysautonomia issues that you're talking about. So I like the Primal Trust program actually to help with the vagus nerve or body work with an osteopathic practitioner or acupuncture or humming exercise. So working with the vagus nerve is one of the first things I like to do. Then I like to modulate the immune response. I'm using a lot of peptide therapies to modulate that. You might have heard me talk about peptides to modulate the immune system. Then, if you do have long COVID on board, I do like to work with different herbs to help with microclots, different ways to remove spike protein, maybe LDN or intermittent fasting. There's so many different methods, and it's different for each person, right? And then I'm probably going to work on detoxification because probably there's a high environmental toxin load. And then I'm probably going to start treating the infections. Now that's the order, the general order, but it's different for each patient. That's for sure.
And yeah, and so just to recap, basically, we have to deal with what's the most inflammatory and what's the most basic at the same time. Because a lot of people do have a mast cell component to their illnesses. It's maybe they don't have full mast cell activation, but usually since the mast cells are your basic immune cell, they're often activate a little bit, and that can just lower some of the reactivity, which is a nice thing to do. And as Dr. Parpia mentioned, structure. When your autonomic nervous system isn't working well, structure is always an issue. And if you're in England, there's probably a fair number of clinics there who have been taught by Dr. Perrin, who's an osteopath, on opening up the thorax, this open chest here, because when the connective tissue between the sternum and the vertebrae in the back are tight, you don't get much lymph drainage is a problem, and you get a lot of issues with drainage from your brain. So as you can see, you're right to be a little confused because this is a game as hey, of pickup sticks, and that's why it's hard to do this as a protocol kind of approach, because it just depends on which part of your system is more reactive. One of the things we have found over the years that for most people, if you've been ill a while, going after bugs aggressively in the beginning often doesn't work. Now, if it's an acute ill, well, if you've been ill, maybe not acutely, but if you've been ill for less than a year, if you find infections, then many times you can go after them and things will work out well. But if it's been a long time, then the body's compensations are at work. And that's something I think we'll come to as we go on. Let's get to some more questions, because actually,
add on to this thing, because I think what I'm about to say is going to answer a lot of other questions. Usually our patients are stuck in a state of perpetual inflammation. And when Dr. Gordon was talking about the compensations, it's really this chronic inflammations on this runaway train that's now created multi-systemic issues. Usually starting by calming that first before we go after the infections helps, because when we go for chronic infections, we're going to release more toxins, our inflammatory cytokines are going to flare even more. So we're trying to press on that immune system before we start to treat the offenders, the bugs.
okay, well, here's a good question for you right off the bat. Please address endocrine disrupting chemicals. So stay away from them if possible, but it's impossible.
Right. So they're in, microplastics are major endocrine disruptors. They're in your plastic water bottles. They're in your plastic Tupperware. So staying away from them is the most important thing. Absolutely. It's very hard to detoxify microplastics. Right now, it appears that the only way to do that is through plasmapheresis. So I'll let you talk about plasmapheresis later on if you like, but microplastics aren't the only endocrine disruptors. Metals are. I'm seeing a lot of people with high mercury and high lead. So really high mercury in fish eaters, just in the blood or just in the urine, not even with a provoked test. So people are having acute exposures to these metals from the food they eat. So you might have heard me say in the past, I think of fish as birthday cake. Literally, it's not a thing to be eaten very often, because I'm seeing high mercury from fish, but I also know that fish contains microplastics as well. Glyphosate is an endocrine disruptor. You want to make sure that you're eating organic as much as possible, because that and other pesticides in our food, they disrupt our microbiome. That in turn can then disrupt the endocrine system. It's all connected. So avoid it as much as you can. And if you test and you see there are high loads, then you want to work with a doctor who's trained in detoxification therapies, because it's not casual. It's medical in nature when you need to remove these from the body.
Yeah, we always like to say that sauna is a good place to start. And making sure your bowels are moving. I mean, those are like sort of the things you have to think about first. Yeah, it's and you know plastics, microplastics are a huge problem. I mean, how they seem to be increasing. I think the best we can do is just try to become aware of the sources, at this point, since they're exposing everyone and we're not all falling down. Probably there's, every time we learn about a new threat, it's easy to become overly concerned. And this is a big one. I am concerned about it, but I just want to keep some balance because it's so much noise about it that I'm afraid that people are going to become like hopeless. And, remember that, just common good sense, you know, give up the plastic water bottles. Try to minimize the time you drink from water bottles that have been in the sun. So most anything you buy in the store that's in plastic, try to minimize that. Not a good thing. And styrofoam coffee cups, because there's not just plastic, but basically the styrenes are a good part of the toxins that we find in people when we go looking. So, stick to glass and obviously non-aluminum metal things as best you
And
can.
you can get ceramic coffee mugs, travel coffee mugs.
Ceramic.
And take that to the cafe if you're having them if you're going to the cafe, because inside those coffee cups are toxins, microplastics actually. Okay, let's go to another question from one that was sent to us earlier. Okay, I've been dealing with Lyme-related dysautonomia for decades, and after years of detox and repair work, most of the autonomic nervous system regulatory functions have greatly improved over time. But the circadian rhythms are discombobulated and continue to be upside down. This is common in our patient population. Yes, if the cause is that there are still more layers of Babesia in the pineal gland and amygdala, is it likely that every last bit of Babesia has to be cleared from those areas to ever start making a difference regarding sleep hours? Erica, I'd love for you to answer, but start with bugs in the brain.
Yeah, because I think that's important. There's no question that some bugs can get into the brain, but most of the time what we're dealing with is effects of the cytokines that are caused by the chronic infections uh, in the brain, not so much the bugs themselves. It's possible. Yes, I mean, we assume since malaria can get into the central nervous system, I'm sure that the Besia probably can too. But in general, that is not what we find. In general, especially when Babesia is chronic, it's usually more in small we call eddies, small back areas of the bloodstream. Like earlobes is one place that you can actually find them under the microscope. So I doubt if there's significant. I mean, because when people do have malaria in the brain, they are very, very sick. So my feeling is that it's more likely that Babesia can release chemicals that affect your brain. And that is for sure, because one of the things we often see with Babesia and somewhat with Bartonella is, really bad mood swings and actually even suicidal ideation where people feel incredibly depressed for periods of time. And they kind of have that sense that it's not them because it's not them. I mean, it's something we clearly see sometimes when we start to kill Babesia, that people will just have these moods overwhelm them and that just wash over them. And they say, it's not me. There's nothing in their life that feels that way. And I think it's pretty clear that these are effects of Babesia on the brain, but I'm not sure you have to have them in the brain. So now sleep is another area. Getting your circadian clock back to normal is difficult for many, many people. And it's often your the hypothalamic adrenal axis is really off. Okay. And it can often relate to how your metabolism is now just dysregulated, because in order to get a good sleep, you have to be able to burn energy kind of quietly through the night. And when you're still stuck in burning and depending on glucose for a lot of your energy, it's hard to get a good rest because your sugars will often drop, and that will release epinephrine and keep you awake until you're kind of exhausted enough to get some sleep later in the day. Um, I don't think I've really answered the question of how do you fix this? I think that's of course. Um, but what I am getting the point that if you're not having other Babesia type symptoms, I would stop worrying about the Babesia and work more on rebalancing your sleep-wake cycles. And I would imagine that you're dealing with, light exposure, blue light, getting the light exposure in the morning. I mean, when people get really sensitive, I mean, many of us get to live lives where we just get up in the morning, go from one enclosed structure to another. But when you're recovering and you really need your body to heal, getting a little bit of early morning light in your eyes, not through the window, because the infrared, which your body needs, is blocked by windows, but just outdoors. I mean, even if you can just be outdoors for 5 or 10 minutes early in the morning, can begin to help reset the clocks. And I'm sure if you didn't, and I don't just, there's a ton of information on something I hate, they call it sleep hygiene. And it's a lot of it's simplistic, but it's definitely something that you have to attend to, which is, not watching a lot of things before bed. No iPads. People don't have iPads anymore. iPads, telephones, TVs, and making sure that the room isn't too warm, and that everything is dark. I mean, I said there's a lot to read about these, and you have to try them because some of us are really exquisitely sensitive to some of these particular things. I mean, there are some people who can, sit there and uh, with their devices and close them and go to sleep, but a lot of you can't. And getting rid of them hours and hours, at least 3 or 4 hours before you try to sleep, is really important for some folks.
Yeah, and I think a nighttime ritual is actually an important thing. Like for some people, it's having a bath. For some people, it's reading a book, having a candle by their bedside, um, dry skin brushing, whatever it is that relaxes you right before bedtime, that can be very helpful. If you just can't sleep, sometimes you need a sleep medication. There's nothing wrong with needing a medication to help you for that, right? If maybe you've tried all the herbs, maybe you've tried 5-HTP and kava and valerian and passiflower. Maybe you've tried magnesium threonate. I'm listing these because maybe you haven't, right? These are ones that can help you sleep. Or there's a peptide trio that can really help people with sleep. Combination of epithalon, CJC, and delta sleep inducing peptide. Those three together can help people sort of change their circadian rhythms when it's added to a nighttime ritual. And sometimes a good old sleep medication to get you to bed, ketotifen, could really work, especially if you have mast cell activation syndrome. You can take it for that purpose, but it really helps my patients sleep usually. So sometimes it's just getting you in bed at the right hour and doing things like the ritual, sleep ritual, and taking things injection or orally that I mentioned that could really help you finally go to sleep.
And break the cycle again,
Yeah.
because long-term sleep medicine is not what we're recommending, but just for a short burst to begin to get the habit back. And because a lot of people, once you haven't slept well for a while, the anticipatory anxiety of lying down in bed is enough to keep the problem going.
What I'm going to do is flip questions back and forth between what we're getting in now and what people have sent us previously. So here's a question. What are you using for spike clearance with those who have severe mast cell activation syndrome and sensitivities? Okay, I'll answer that. I'm not trying to clear a spike or anything. I'm not trying to do any of that for somebody who has severe mast cell activation syndrome. and sensitivities until I've got that under control first. Okay, so that's really, I need to make that really clear, because if you're trying to remove spike or trying to kill an infection, something that's going to create further inflammation in your body, you've already got mast cell activation syndrome, it's just going to potentiate that. So calming the mast cell activation syndrome first. I'm not going to tell you how I do it yet unless someone asks a question, because I want to get to all the questions, but you want your doctor to calm that down first. Then we can, once that's calm, then we can work on spike removal actions. So there's augmented LDN, sorry, augmented NAC, which can help. That's an NAC from Italy. LDN has been shown to help. Nicotine patches have been shown to help. While we're working on a spike removal, melatonin may help, higher dosages. While we're working on those things, we want to make sure that the body is also, that we're also working on the microclots as well, with things like nattokinase and serrapeptase, lumbrokinase, for example. Yeah, I hope that answers your question.
And here's a good one that I don't have the answer to till I start talking, which is, how do you determine the most inflammatory versus the most basic issues? Um, as Nafysa was saying, the MCAS story, is a good one. To start with, mast cell activation is a good one. I mean, in the old days, I said a lot of times that was mistakenly thought to be a herx, because as soon as you started to kill anything, people had these really intense reactions. And yes, it can just be, quote, a herx, but if it's a herx, it's usually better 2 or 3 days of continued treatment. Mast cell, as long as you stay on it, what's irritating the mast cells, you're going to keep reacting. So, when the mast cell symptoms that we think of, basically headaches, migraines, uh, esophagitis, breathing issues, asthma, but we don't see that much of that. But it's more a lot of gut issues, urinary, any kind of pain with urination, burning, frequency. These all can be mast cell issues, as well as a lot of the people often, the dysautonomias. Many times, the POTS and things will quiet down when the mast cells are quieted down. So I guess that's the first layer. Is and then just you have to. This is the I'm using all my favorite names for things. The games that we play, pick up sticks and pin the tail on the donkey. Okay, because unfortunately, if you are sensitive, everything we do has a potential to inflame you or aggravate, and so you just have to you have to become an aware sensitive, an aware patient, and have a doctor who's willing to listen to you. So and understand when you try something and you feel worse, it doesn't mean that it's bad for you. It just means that you might need less of it, or you need to do something else before you can tolerate it. So if you take something that flares your symptoms and you take less and you can't get to a minimum where it does, well, then you have a system that obviously we need to have to lower the inflammation before we can go after the underlying problems. That sounds simplistic. It is, but it's difficult to do in real life, but that is the way forward. And it's always nice to not be a sensitive patient. Because if you are, this is a dance that just has to often be repeated many times. Each time you add something, you might find that it's at too high of a dose. You need to go slower. And at the same time, you might need to balance the reactivity. And that often is with things that quiet mast cells or quiet other parts of the immune system. And that's the dance, because like LDN, for instance, is usually used to quiet the immune system, to help modulate like the toll receptors and many of the inflammatory chemicals. But in some people, when they start it causes a jolt. And usually we can find a low enough dose to sneak it in, because your body, when you get to the level of real reactivity, it's like I always say, like an angry 3 or a very tired and hungry 3 or 5-year-old. Okay, has to be has to be dealt with gently. Yelling at a 3-year-old generally does not get the situation to quiet down. No.
Yeah, it's interesting when you're talking about these tiny dosages. A lot of our patients do need sprinkles or toothpick dips of a dosage of something that's supposed to otherwise quieten an aggravated immune system. Sometimes less is more. People will actually see an effect from super low dosages of LDN if you're highly sensitive to it. Okay, here's a question, one that was sent to us earlier. Are there any circumstances that mold? I've just lost my voice. All right. Are there any circumstances that mold urine mycotoxins would be higher after a year of treatment and remediation, other than still possible mold in the home? I would say absolutely. So when we think about mold, we have to think about understanding it in many, many different ways. And the first thing I think about is exposure. Is my patient exposed? Is that exposure in the home, in the car, somewhere outside of them? Or is it inside of them, right? So if you're still creating mycotoxins, chances are you still have an exposure. If you know it's not in your home, or you know it's not a physically outside of you exposure, then probably it's inside of you. So I see high levels of molds in different sites of my patient's body. So depending on their symptoms, I'll test that. So there could be mold or funguses in your sinuses, in your ears. If you have symptoms in those areas, I'm going to be testing that. Some people, I found it in their lungs, aspergillus in the lungs, for example, in the genitourinary tract, and of course, in the microbiome. So you want appropriate testing for funguses or molds in each of those areas, and then you want to have those treated.
Yeah. Very.
There's so much more about mold we can talk about, but I'll leave it to this question.
Yeah, but just very important that some people, mold carriage is a very real and significant aspect of what's going on. And there's a bunch of good questions here. Let's see.
I wanted to answer this one first. Warren Riggle. Warren, we're going to answer your question. I'll read it out. Thank you so much for having the Q&A. I've had chronic neck pain since 2013, which got much worse in December 2022. I have had 9 to 10 out of 10 neck pain since that time until November 15th, 2024, when I was recently diagnosed with Ehlers-Danlos syndrome, cranial cervical instability. I'm a retired veterinarian and have chronic Lyme and Besia, which is treated in 2019 to 2021. My neck pain is much better with a neck brace used as needed and help from an EDS physical therapist. The reason why I wanted to answer this is not only for you, Warren, but there are many, many patients who have this issue. And Eric, I'll let you start with answering that.
Well, I mean, one of the first things, I'm glad that the physical therapy and the neck brace is helping. Neck brace, obviously, people have to be careful with not overdoing, because the muscles will get weaker if you use it all the time, but intermittent, it's wonderfully helpful for those positions that are stressful for you. And it's great to, when a knowledgeable physical therapist and body workers can help with the structure and keep you from aggravating the lax ligaments. Because basically, when people have Ehlers-Danlos, and you don't need the diagnosis of Ehlers-Danlos, there's a whole spectrum of lax connective tissue that we're just becoming to realize. And this is something that, as a shout out to good Dr. Shoemaker, he started to notice this probably, oh my God, maybe 20 years ago, that he seemed to have a lot of patients who had very long arms, and they had a lot of volleyball players, and a lot of them actually are a little more flexible than the average. And and we've noticed it too over the years that we just seem to have a lot of flexible people. I mean, I'd be amazed at how many older people who, their hips were still really flexible. And they weren't yogis, but it's because the people who wind up with chronic inflammation have a tendency for this flexibility. And there's some connections, probably genetic, with where the genes are for the tissue, not tissue strength, but for the genes that have a lot to do with the tensile strength of connective tissue happen to be on the same genes that have a lot to do with how your body deals with how your immune system responds to the environment. So there's a close connection there. But more importantly, is chronic infection is often what sets this off. Millions of people are very flexible and go through life fine. But when they get infections, especially Bartonella, but it happens with many infections, the inflammation makes these ligaments more flexible, more lax, and then then the muscles have to take over, okay? Because especially in the neck, a lot of your structure is held by these ligaments, which hold everything in place and allows your muscles to be relaxed. When the ligaments start to get a little lax, the muscles get tighter. And unfortunately, the tighter the muscles get, the more abnormal tension is often on the nerves, and also the less space you have for your brainstem sitting in the base of your skull and the spinal cord as it comes out, which can activate your mast cells and cause dysautonomia. So this is why this is such a big deal. But getting to Warren, I would look back and make sure those infections are really gone. Sometimes the damage is done, but many times there is still residual inflammation that would help if that was taken care of. And once this is, we are peptides, and I'll let you talk about that, can sometimes be helpful to restore some of the normal integrity of the ligaments. And there are some injections that seem to be helping. That's a little too early to know for sure which kind and who are going to respond best. But if you're having a lot of pain, it's something to look into. The last step is obviously surgery for CCI, which is something that is really last step, because like all surgery, you can't undo it, and not everyone is successful, even if sometimes symptoms that we think are due to the CCI seem to be happening for other reasons that the surgery doesn't fix. So injections are probably always the first step. But
Yeah,
now peptides.
I actually really want to stress calming down mast cell activation syndrome, because the chemicals that the mast cells release tenderize our ligaments when it's perpetual, when it's chronic, okay? And usually for these patients, it is perpetual and chronic mast cell activation syndrome. And so calming the mast cells, stabilizing them, will often typically allow for the ligaments to be more stable because they're not tenderizing them as much. So about peptides, I like to use peptides to control mast cell activation syndrome and modulate the immune response. KPV and amlexinox are two peptides that help significantly for stabilizing mast cells. GHKCU is a peptide that helps strengthen our connective tissue. So you can get from the compounding pharmacy that your doctor works with, GHKCU cream mixed with BPC 157 cream. The BPC 157 will help bring down the inflammation, and GHKCU will help stabilize the connective tissue. You can also inject GHKCU subcutaneously. Some doctors will, what were you going to say?
No, just say that just means right under the skin. So it's not a deep injection
Yeah.
at all. Anybody, something
Yeah,
safe
not
to
deep.
do. Yeah.
Yes, very, very shallow. And then you can, if you have a doctor who does injection therapies, they can do neural therapy, which again is just shallow injections. We're not talking about going into joints, just shallow in the muscles, GHKCU around the muscles of your neck, and that can really help as well. I wanted to go over Amir Panjwani's question. Okay, he says, I ran immunoscience long COVID panel test, and I am positive for long COVID and also positive for EBV, VCA, IgM. Is this mono? Positive for EBV, VCA, IgG, and EBNA, IgG. What specific herbs and peptides would you recommend to treat this? I'm thinking TA1 peptide would be helpful. I'm also currently on itraconazole and mycotoxins for 4 months now. Okay, so
Let me
this is a big question. Yeah.
let me hit the first part is that when you see normally when we see an IgM for EB for Epstein-Barr, you think that's definitely an active infection or an acute infection. Obviously,
You mean the IgM for these, right?
the IgM. I mean
Yeah.
that's usually associated with acute infection, but the reality is that in some immune systems when this bug pops back, because this is a bug that you probably got years ago. I mean, this is something we've seen. I mean, Dr. Parpia has talked about before. When you have COVID, the thing that makes long COVID for probably maybe half the people is not just the COVID, but the fact how it affected your immune system is that these otherwise quiescent chronic, low-lying infections like Epstein-Barr, which I said probably 98% of us have in our B cells, but they're quiet. They're not really doing too much. But once we get COVID, sometimes our immune system loses control and the EBV starts to significantly reproduce, causing symptoms that way. And when you see these antibodies popping up, that may be happening. Now, it's especially strong because the IgM. We see a ton of people with the VCA is the viral coat, and the EB is the early um, I'm sorry, it's the nuclear antigen, the EBNA, and these are signs of viral persistence and viral reactivation. Very common in people with chronic fatigue, and treating them directly in chronic fatigue helps about a third of people, and about 2/3 does nothing. And it's about the same thing, I think, with long COVID. So it's worth treating, sometimes using the antivirals, and always worth going after with the peptides, which I'm going to let you, since you use more of the peptides, how would
Yeah.
you
Yeah.
approach this?
Before I go into treatment, I want to go back to that reactivation as an adult. If you've got an IgM and it's new, it's not new, like Eric was saying, it's probably reactivated. I want to understand, well, why is it reactivated? Do you still have issues with spike protein? Do you have some other bug that's festering? I shouldn't use the word festering. Do you have some other bug that's active, right? Some other microbe, tick-borne diseases, could be COVID reservoirs. Want to know those things because
Or your favorite toxins.
or my favorite toxins, yes, environmental toxins. I see you're on itraconazole. You probably have mycotoxins, right? So what's reactivating that? I want to deal with that thing as well. It's often that I'm not treating viruses right off the bat. I'm working at mold first. I'm working at tick-borne diseases first. That's not for everybody. Some people you go after the virus first, and that really helps. But I want to talk about using TA1. So TA1 is thymosin alpha 1. It's a peptide that's going to put the pedal to the metal, if you will, on your immune system. It's going to ramp it up to have you start killing off infections. And it was shown to even help with COVID. Now, when people start using TA1, I'm talking about people who have complex chronic illness, okay, people who've got mast cell activation syndrome, immune dysregulation from all these multiple root causes. When this patient population starts using TA1 first, it's very often that it's too much. The patient isn't ready to handle what TA1 is going to cause the immune system to do. Okay, so I'm wanting to quieten down the immune system first with other peptides like TB4 or KPV, as I was talking about earlier, Amlexinox. Lorazepam helps dramatically with patients who have symptoms of leaky gut. So if there's leaky gut and mast cell activation syndrome, those two are going to potentiate each other. So I'm working to calm down the immune system first before I start to ramp it up. And it's not like those two things are contradictory in nature, but they're synergistic. I'm trying to get the immune system in line. I do this because I'm thinking of having your immune system is like having a confused fighter in the ring. They're throwing kicks and punches and in the wrong sequence at the wrong person, usually yourself, right? So I want to bring that immune system into alignment first. Then I'm going to start using TA1. You're using itraconazole not to bind mycotoxins, but to kill funguses. I want to make sure that you know that, okay, because you were saying that you're on itraconazole for mycotoxins. When we're thinking about mold, we want to think about mycotoxins and we want to think about the mold itself, okay? You're killing the mold with itraconazole, but if I were your doctor, I'd want to make sure that you're doing something to bind up the mycotoxins as well, because that's really important, because mycotoxins are highly inflammatory to the nervous system, to really every system. So, okay, I hope that answers your question.
Yeah, and as Dr. Pejman, we spoke to, I think it was for this for this forum. He pointed out that itraconazole also is very good at lowering inflammation in the gut, which he feels has a lot to do with why the molds in the gut are causing problems, is because of the secondary inflammation. It allows other endotoxins, other inflammatory chemicals to get out. So and that's where the lorazepam would also help.
Yeah. Okay, so we have 15 more minutes left, and
Oh,
I'm
go.
going to bounce between both.
Oh, okay, that's a
One
good
second.
question.
Which one?
Timing and hierarchy of binders. Okay, so this is a whole good question.
Okay.
Let me deal with this one.
Okay.
This is one, and this is a work in progress. I want people to understand. Okay, please discuss timing and hierarchy of binders after an episode of plasmapheresis or inospheresis, and as additional episodes of filtering are undertaken. Discuss the tempo of toxin release from various compartments of the body and how to change the binders depending on what compartment is being evacuated. Great question, because it's something everybody's trying to figure out. I mean, people will have answers for you, but it's in process. But first, let me just say a little difference between inospheresis and plasmapheresis. At this point in time, inospheresis is only available in Europe. Hopefully by next year, it will be available in America. Inospheresis uses a filter to filter out toxins, abnormal shaped proteins, and then returns almost all the blood to the body. And it is good at removing toxins. Plasmapheresis doesn't use a filter. The ones we use in America mostly uses centrifuge. So we're taking out a certain molecular weight of chemicals, which is basically mostly albumin, which is one of the major proteins in the body. And then we take that out and we really remove it from you, and you need to have more albumin, fresh albumin replaced, because it's a lot of volume. Like a lot, like up to 2 liters. That's a lot of volume. Needs to be replaced. But anyway, so the difference is that when the inospheresis is mainly toxins, the plasmapheresis is getting toxins and a lot more hopefully abnormal proteins out of the system. These senescent associated proteins, things that are signals from your senescent cells that have been gotten ill and haven't completed the healing cycle and aren't back fully normal, but they haven't died. Those cells produce signals that would be appropriate if your body was still inflamed. And unfortunately, since it's still producing these signals, there is a low level of inflammation in the body. And by removing it with plasmapheresis, we hope to get your body to forget about the inflammation, and maybe those senescent cells, without having their signaling molecules coming back at them, will decide to either die or finish healing. That's what we hope. And it does happen, but the question is how much? That's to be determined. So the ionospheresis will remove larger amounts of toxins than of certain toxins than the plasmapheresis. Maybe 2 or 3 times. We're still figuring that out because we're one of the few places that I've had patients I've sent to Europe that have done ionospheresis, and they've come back here and I've done plasmapheresis, and I've sent the plasma that's been removed to the INIS lab in Switzerland to have it evaluated. And we can see that the removal of the toxins are fairly similar, but the ionospheresis, because it's a filter, is getting more. But as I said, they're not getting as much of the signaling molecules, which I think is also important to remove. So both are useful. Now, the main part of the question is, how do you keep the detox
I think you were
going?
asking about mycotoxins binders specifically. I'm just trying to
I
find
don't
that
think,
question.
no, they were asking about what level, how do you sequence
Okay.
toxin removal? Because that's the thing. Because once you do that, anytime you do chelation, whether it's heavy metal chelation or in this instance, it's not chelation, but removal of toxins, it kind of lets the body then get rid of more. Okay. And so that is the question. So often with ionospheresis or plasmapheresis, it's often a good idea to do 2 of them within 4 to 5 days of each other. That seems to be a really nice timing to get that secondary release. Also, as we've learned from chelation, where it's easier to much more less expensive, and we can measure the metals that come out. If you measure the mercury and lead levels in those days after chelation, they're higher for 4 to 5 days after the initial chelation. So that's a time when you do want to be taking more binders. And those, if it's the metals, things like DMPS and calcium and EDTA during those 4 to 5 days to keep helping your body get rid of what your body has now been able to mobilize. Because that is the problem, is you're mobilizing toxins and you want to get them out of the body, not just get them to redistribute in the body. And the same logic is reasonable with the plasmapheresis and the ionospheresis, understanding that there are some metals being removed with them, but those are mostly more fat-soluble type toxins. And we don't have, the binders are not as specific. So, I mean, you could use cholestyramine. I tend to use Pectisol during those times after the plasmapheresis. But this is a work in progress because the amount of toxins coming out is something we're just discovering. People were not really looking. The plasmapheresis had been traditionally used to remove antibodies to help with autoimmune diseases, and also with some acute toxin exposures like snake venom and mushroom poisoning. But it really wasn't quite well understood how much general toxin load, including microplastics, which is really interesting. And again, how much microplastics come out, the measurements are just being started, and the labs to do that in, again, work in progress. But it's being done. So the answer is yes, we have to keep, especially during that first week after any kind of strong detoxing treatment, such as plasmapheresis, ionospheresis, or even chelation, keep the binding up with binders, and but what's the best ones? I don't know yet. We're working on that, but I think, Pectosol, cholestyramine, um, the chlorophyll, some of the seaweeds, probably really useful. But again, you got to be careful with the seaweeds on where they're grown, and where they're from. I'm sorry if I'm talking so much. I don't remember the
No,
rest
that
of
was
the,
great.
I don't remember
I
the rest of
can't
the
find
question.
any other. I can't
Find
find
the
it.
question.
I've
So
been
hopefully I
searching.
answered enough of that question. But come back next year and we really should have some real data on that. That's the exciting thing, is because
Mhm.
we're actually, not just us, but other people all over the country are actually involved in measuring this stuff. So we'll have hopefully some really good answers, and be able to guide people on what to do. But one thing I want to add about toxins real quick, and I'll be very fast here, is the absolute level of toxins. Uh, how do you say? The, you know, we know that high levels of certain toxins are bad. I mean, lead, mercury, and cadmium, and again, it's clear we have the physiology, but a lot of the toxins that we get out with these devices, when we take them out, like we're still getting a significant amount of DDT, which was banned, in 1976, and its derivatives out of the body. Now, what level is bad for people? Any level. But what level causes symptoms of some of these chemicals? We don't know. Okay. And that's the difficulty, because what is toxic in your body might be fine in mine. I mean, we see this with lead, because the lead levels in people who worked in battery factories back in the 70s were super high. I mean, they didn't think the lead level was above 80 was considered passable. And now we know that even one microgram, not a microgram, it's 1 part per million, is too much, and it affects the brain. But because those people weren't having terrible symptoms, everybody thought it was okay. It was only when they looked at more sensitive populations, like young people, that they discovered that any level is not good for us. And so we have all these chemicals that are coming out, and don't be freaked, because they're in all of us. And it's your sensitivity. So if you're robust and healthy, it's good to get them out. If you're sick, these things may be very important for you. And we're still figuring out the answers. I wish
I
I had a
mean, we're
clear
seeing we're
cut.
seeing chronic illness now more than we did in the past 15 years. And I think that's because there's more microplastics, there's more metals, there's more environmental toxins, more glyphosate. I think that these toxins are what's underneath this frequency, this new input of patients over the past 15 years, and then over the past 5 years more, because we've got the toxin of spike protein on top of it. So I can't stress enough how much I think environmental toxins play a huge role in the immune system, and why people aren't able to walk hand in hand with these bugs. So I think that if you have a high load and you're toxic, considering plasmapheresis or intravenous therapies to detox you by someone who knows what they're doing is an important thing. Um, we have
Uh,
time for one more question.
Oh, that's it. Okay, well,
Yeah.
I bet you a quick one is that vagal nerve stimulators do help some people quite a bit, and other people it can really flare them. It's so, I mean, and if it flares you, less. I mean, because they often come out, many of them, have suggest using them for 2 minutes to 5 minutes to long periods of time. Some people have to start with seconds, because if your system is sensitive, the stimulation is too much. I wish I had a better answer than that, but they do work and they're worth trying. They can be helpful. Again, once you lower one part of your body's um, self-protection, overprotection policies, everything else works better. It's that simple. Your body is trying to keep you alive. It just often has bad habits that don't serve you any longer, but it's still a habit. I've said this many times, the neurotic tendency of the body. Okay. So just as though the self-protective habits that you learned as a child, like either whether it's withdrawal or anger or, whatever it may be, they're okay to use. But if they're your only response to the world, life often isn't fun. And it's the same thing for your immune system and your nervous system. If it has to hit back hard all the time, you're not going to be doing well. So anything that can begin to relax the nervous system is worth using.
Okay, one more question. We have 2 more minutes. So, what are your thoughts on muscle testing? Do you always confirm with functional lab testing before developing a protocol for different infections? Okay, so I like to use lab testing. Okay, there's nothing wrong with muscle testing, but I will never use it to make a diagnosis. If a patient wants me to do it, I'll do it to confirm something that we're already thinking. But as for making diagnostics, I really want to see that biochemically.
And again, muscle testing I think, is intuition activated. I have seen it be right on, but I have also had some of the leading experts in muscle testing in my office, and I've seen them be totally wrong. Um, it's something, it's a piece of information. And same thing with lab testing. They're information. I spend a fortune on lab testing because I think it's useful and important. But many times the clinical diagnosis is we have to go on. So, it's which yeah. So when you're chronically ill, our tests haven't caught up yet with what's going on in your body. So yes, I like to have lab tests, but we see plenty of people who have Lyme, whose tests are negative because their immune system isn't working, or the Lyme is suppressing it or hiding, or is so much there that there's no antibody to bind, no antigen to bind, and you treat. And with 2 or 3 months later, the test is floridly positive because the immune system has seen it.
Yeah, but I wouldn't rely on muscle testing to make that diagnosis,
No.
but really on the doctor's clinical experience
Yeah.
and doing your clinical history. That's what I would rely on more. But muscle testing, if it works
For,
in that moment, it could be a great thing.
yeah.
But
Again,
just not for diagnostics.
right.
Yeah.
It's there are many gifted people who I said it's aiming their intuition. It can be a useful adjunct.
Mhm.
But I wouldn't bet the farm on it.
Okay, we're out of time.
Uh,
Thank you all for joining us. We really enjoyed these, and we'll do another one. There's just so many questions pouring in, and we will be back for more. I'm not sure when, but you will find out in
yeah.
your email the next time it happens. I want it to be sooner than later. Yeah.
Thank you all for your attention. I hope we always give you some useful information, and just know that this is a difficult area. But everybody out there is a lot of people who are working hard to try to get more clear information and just more clear diagnostics and treatment modalities available. So thank you for joining us.